All right, we are moving on to our next speaker. You heard him earlier on stage. He was born, I believe, in the Soviet Union, not even Russia. It was when it was still the Soviet Union, but obviously he's come to America. Tremendous background in investment and in healthcare. So now we are going to hear from the man from Wealth Network. He is Ildar Fazulyanov, the CEO and founder. Ildar, take it away. You got 8 minutes?
Yes,
go.
Thank you. Hi, Ildar, founder and CEO of Well. And Well Network is a healthcare platform powered by blockchain. If you can power up the slides, here you go. So, so imagine getting sick. You got to find a doctor, schedule a visit, then give this doctor your information, which you often don't have, and then finally follow a treatment plan. It's really, really hard. Being sick is super difficult. So right now, pretty much anywhere in the world, I mean, Hong Kong Hospital Authority, I was just blown away, you know, how technologically advanced it is. But nevertheless, anywhere in the world, when you get care, one person determines, basically often life and death, and determines what kind of treatment you're going to undertake. And often it's not even a doctor. It could be a nurse. It could be, you know, a person at an insurance company, some clerk that makes a decision whether you're going to get this drug or that drug, this treatment or that treatment. That's incredible power that we're giving away. And actually, that's how I started this company 3 years ago. Something happened to me. I broke my leg, and then, you know, the doctor chose one plan that didn't work out for me very well. So another thing is accessibility. I was trying to find a physical therapist for over 3 weeks, and so I re-broke my leg. My mother, who's Russian-speaking in LA, waits for 60 days to see a nurse practitioner that speaks Russian. 60 days. And then you have to stand in line. So we're here because of blockchain, a lot of you, right? So one thing that blockchain does, it's uncensored, it's objective. It's accessible 24/7, 365. That's why a lot of people are trading cryptocurrencies right now, right? Second, smart contracts eliminate a lot of process cost. So our mission is to remove all non-care from healthcare. And finally, it's frictionless. When I was ordering Uber here in Hong Kong, I couldn't take a cab because cabs here don't accept US dollars. They only accept Hong Kong dollars. And I didn't want to go get Hong Kong dollars. So with Well Token, you'll be able to basically get healthcare anywhere in the world. And it also removes a lot of the cost in the system, because in the United States, providers spend over 30% of their costs on collecting money. So, you know, one thing, we have a functioning platform, and one thing is that within 15 minutes, anywhere in the world, you can basically see a doctor anytime, all the time. So we're talking to a large clinic in Russia, and my mom could have access to 1,600 Russian-speaking doctors for a relatively inexpensive price. So what's another great thing about blockchain? A lot of people have been talking about it. I see it as the greatest redistribution of wealth. I grew up in the Soviet Union, and after the collapse, there was a so-called privatization. Everyone got this voucher, and most of those vouchers became useless. But if you bought, you know, shares in any oil company, pretty much, you were going to make money. And you know, a lot of people say data is oil of the 21st century, and medical data is the most important data that we have. And we own it. We should own it. So whether it's medical records or DNA data. So Senior Vice President of Ancestry is investor, friend, and, you know, dear friend, and also investor in the company and advisor. And so I did an Ancestry DNA. I downloaded their file. You can steal some of my genome here. That's actually my DNA. And so what blockchain allows you to do, and specifically for us, is we're using permission blockchain, which gives, with crypto keys, permissions only to certain people or at certain times. So if I wanted to sell my DNA data to a pharma company, I could do so. And if they pay me well tokens to do so. So that's very powerful. So everyone's talking about AI. We don't quite have AI. I hate to break it to you, but we do have very powerful machine learning. And so one of the differentiators of Well is that we're a telehealth company, but telehealth, in my opinion, is a commodity. And so by adding actual doctors that provide second, third opinion and make decisions, and then owning this data and making decisions about data on the individual level, that's a huge differentiator. And most of the machine learning companies actually look at the data sets in the past on a combined population approach. Whereas with us, you can own your own data and use it case by case and make decisions, future decisions about your healthcare. So it's a combination of your doctor, second opinion doctor, third opinion, making a decision plus machine learning to make these decisions. Very powerful. So telehealth is actually the fastest growing segment of healthcare, projected to be over 100 billion in the next few years. But again, like I said, it is a commodity. Pretty much anyone with a Skype. I mean, there are HIPAA laws, of course, there are processes. I'm not, it's not quite that straightforward. But really, it saves time mostly for patients, not providers. And so by adding some of the machine learning, some of the things that we're adding, and improving patient outcomes, providing smart contracts for providers to manage a lot of their processes, we can actually save time for both sides. So now suddenly it's a very powerful tool that doctors want to use as well on our system and save time and money and drive results for patients. So we've been in business for 3 years, like I mentioned, conducted tens of thousands of telehealth visits, 23,000 last year. So it's a functioning platform. You can actually see a demo of it on joinwell.io and sign up. So another great thing about crypto that I love is just it's such a huge wave that it attracts amazing talent. And so I started a fintech company. My co-founder, Alex, was an early investor in Lending Club. Jeff Barson was actually head of Skunkworks at HireView, which is a video interviewing company that works with CIA, FBI, and utilizes machine learning. Brian is a friend, Ancestry. Paul is former general counsel of Blue Cross Blue Shield. And we have some amazing crypto talent going back 8 years when it was all starting. So I think that's my time, so I'll just leave it for Q&A. Another, I guess, really quickly, is that we want to focus on diseases that are common enough, but the doctors in, for example, cystic fibrosis, there are not a lot of doctors, but there's a lot of people who have it. So by creating a global platform, we can really add a lot of value to those patients and connect them to the right doctors. So the question. Want
me to come and moderate, or are you good to go?
No, you go ahead.
Okay, no, you can read. If you want to read them yourself, that's good, or I can help you out. I'm good at reading.
You help me out.
Okay, how do you manage patient data confidentiality in your business model? Olivier wants to know.
So we are permission blockchain, so we store data off public blockchain. However, we anchor the state of our blockchain to public blockchain. And that's actually also, there are crypto keys that we use to unlock the data. There's a lot of mechanisms that we're using, but yeah, we're very careful. And until we know for sure that it's not going to be hacked, or we don't know the smart contract is not, audited, we're not going to do anything that's dangerous.
Sounds good. Are you guys a big target? I mean, our next question from David is if crypto is so secure. They want to know about how money keeps getting stolen from crypto exchanges, and obviously, I don't know if you're going to speak for the whole concept of blockchain and how secure it is, but for your network, I mean, you're not as big a target maybe as a crypto exchange, but how do you approach this whole issue of security?
So, I mean, it's not the crypto keys that get hacked, it's actual systems. So crypto exchange is actually, if you're really, you're basically giving them permission to store your crypto wallets, and they're actually, like a big bank that holds all that information, and these hackers, robbers, basically break in. So crypto key itself, it's like all the computing power in the universe for 15 billion years cannot break one crypto key.
Yeah.
So I just want to make a distinction. So it could be social engineering to hack. It could be all sorts of things.
Yeah.
So.
Yeah, absolutely. You're absolutely right. Ladies and gentlemen, please, big thank you for Ildar Fazulyanov. Thank you very much for coming all the way from the West Coast.